Hi, I'm Alicia Jensen from the Power of the Patient Project, and today joining me.
Hi, I'm Annette Reboli, Dr. Annette Reboli at Cooper Medical School of Rowan University.
So today we wanted to kind of have a session about how you're teaching these future doctors a bedside manner almost, because I feel like we've kind of lost that a little bit. So some patients believe that doctors are not as compassionate as they once were, and that bedside manner has disappeared from the practice of medicine. I know that medical schools are trying to change that misconception by telling their patients, making them more comfortable and being more compassionate. Tell me how medical schools today are training new doctors to be more patient-centered.
Well, this is a multi-step process for us, and it's embedded throughout our curriculum. Now, that's one of the advantages of being a new medical school. We could start fresh and address everything that needs to be addressed to best prepare our students to be excellent providers of care, humanistic, compassionate physicians, patient advocates.
Yeah.
So we actually have a Center for Humanism here. And it's a fledgling center. It's being developed through philanthropic efforts. And the gist of that is to make sure that at every curricular touch point, we embed humanism, not just learning the science of medicine, but also the art of medicine. Yeah. And some of the loss of the art of medicine has been driven by technology. Up until the mid-1900s, there wasn't a lot diagnostically or therapeutically that physicians could do for patients. So there was more listening, more helping patients through difficult transitions in their life, helping them through struggles medically, or even helping them through death and dying. So we're trying to return to that with some of the special features of our curriculum. With every case that our students discuss, and this starts from day one, actually I should back it up from our admissions process. So we get about 6,000 applications a year for about 100 slots. So we're not only looking for students that are exceptionally bright, we're also looking for students who have the altruism, the experiences in their communities. We're doing what's called a holistic review of our applicants. So that's the start of it. Then when they come here, our curriculum is very modern. There's very little lecture-based content. A lot of activity happens in small groups with faculty preceptors. So our students are learning clinical applications of the basic science from day one of medical school. We have an ambulatory clerkship very early on. Most schools have this starting in year 3. We start from the beginning, and students interface in a very graduated, progressive manner, working with patients, learning about barriers that patients face, learning cultural competency, learning to interface as our demographics change, learning to interface with individuals who are different from themselves, to have different beliefs about their health and well-being. As part of our professionalism aspect, our professionalism curriculum, we also emphasize the right of patients to determine their situation. Yeah. So there's less of a paternalistic approach in making sure the patient's well-informed, that they're a partner in their care. I always tell our students that they'll meet many fine educators, many famous professors who will teach them, but the most important educator of our students are patients, and the way they interface with our students, and they're raising a new generation of physicians.
Yeah, I mean, it all starts right at the beginning of medical school.
Absolutely.
And that's where they learn all of their compassions and, being there for those patients that need it.
Absolutely.
So as part of their medical education, do medical students go through any types of simulations or role-playing to learn how to be better communicators with their future patients?
Yes. So simulation is a very important part of our curriculum. Working with standardized patients who in some ways serve as actors, but also bring their experiences to the table as patients, non-physicians, non-educators.
Okay.
So, for example, you could come and be
like
a
the average person,
regular person could come and be a standardized patient. There's an educational process for them, and they actually rate our students. So we've embedded this in our admissions process.
Okay.
So we have our students in our admissions process meet standardized patients who rate them.
Wow.
And then a faculty member, dean, also reviews the tape and gives a score. So to get into our school, you have to have a good rating by a standardized patient. Then throughout our curriculum, our students not only work with standardized patients to learn communication skills and different parts of the physical examination, but they also are tested in that venue. So at various time points in the curriculum, they'll have observed structured evaluations that involve standardized patients.
It's really cool. I like that a lot. I think that kind of like also gives them a little bit of a glimpse of what they're going to be doing, because it's like a real life simulation.
It's a real life simulation. It's a real life scenario that they are training on. Now, the emphasis on patient-centeredness and communication with patients is something that we're working on across the continuum. We have medical students, residents, and our faculty as well. So at Cooper Medical School of Rowan University, we're working with all groups. The hospital, for example, has spent a lot of time, every single resident and faculty member has gone through a structured program to re-emphasize these aspects of care, how they interface with their patients and how they work with their patients. So we're not only emphasizing it with our medical students, but across the continuum of providers.
Because it's always something that just needs to be reminded of every single time they walk into the hospital.
Yes.
So in light of the fact that medical students are entering an era in medicine when insurance companies, we love those, are telling doctors to complete the exam in 10 minutes or less. How is medical education dealing with this? And I know that a complete encounter with the patient is crucial in order for the doctor to arrive at the right diagnosis and make the decision as to what is the best treatment plan for that patient. So how are you preparing the future physicians to deal with the limitations placed upon them by these insurance companies in the fact that enough time needs to be taken to make the right decisions for their patients?
So with two aspects. First of all, leveraging technology to make technology work for them and allow them to, actually I would say three aspects. So leveraging technology to make technology work for them and not against them in the patient environment.
More of a convenience kind of.
Right, learning how best to use electronic tools and have those be part of it, learning how to leverage the electronic medical record, where now a lot of patients have access to their records and can ask questions of their providers. The second piece is the interprofessional piece. So it very much takes a team approach to care for a patient, not just physicians on the team, but nurses, social workers, many different providers. Also leveraging the skills of those other providers so that the physician isn't the only person communicating with the patient. It's a team approach that works better for patient care. It enhances quality, safety, and I think that that's also how the practice of the future will be with medicine.
I think especially with technology, it should be less about convenience and more about the quality and using that to your advantage.
And the third piece is developing our students as leaders. So within the mission of our school, we've embraced core values. And one of those core values is patient advocacy. Always putting the patient first and centering on that. So doing the right thing for every patient at every time point.
So kind of instead of focusing on these insurance company timelines and deadlines and how much time they're supposed to be with the patient, it's more about the quality
and the ability to speak up. Being able to speak up to advocate for your patient. We encourage that throughout. Our students also have a very rich service learning experience. And what they do is they go into the community And our graduating class, we tallied this, did 11,000 hours of service to our community. Wow. But as service learning, going into the community allows you to see other aspects of the lives of our patients, not just seeing them in your office or in the hospital setting, but seeing them where they live, where they go to school. Our students have done some amazing things, teaching English, teaching science to children, teaching soccer, interacting with the patients. And then we bring our students together in small groups with a faculty facilitator. And what they do is they connect the dots between the lives of their patients and what they see in the clinical care environment. Yeah,
that's cool. I like that. If patients want their doctors to be more available and more caring, what do you see medical schools doing in the next, upcoming few years to make sure that happens as more and more doctors become employees of large, complex medical systems? And these large systems seem to be removing the closeness and accessibility that patients once enjoyed with their healthcare providers.
So I think that this harkens again to the emphasis on healthcare providers, not just doctors, but all of the providers that are working with that patient.
As a team.
As a team. That team approach, I think, gives more of the personalized, customized care to the patient. Again, the leadership qualities of our students to be able to speak up. I always tell our students, by the very fact that you have MD after your name and you have a white coat, that also confers the ability to get the attention of thought leaders, governmental leaders, leadership of different companies. If you go into a community setting and you speak on behalf of your patients, they will listen carefully to you. So we're also teaching our students those skills of how to communicate. We're going to have an event that's coming up this fall that's actually a communications workshop. And it's through Stony Brook, Alan Alda's center there, and Mr. Alda himself is coming to actually work. And I'd heard him speak about a very compelling event in his own life. I heard him speak at a national meeting, so this is the genesis of us inviting him here to visit us and working with our students, our residents, and our faculty. And he told a little vignette about being a patient in another country, and he had a serious medical illness, and he was going to be evacuated out of the area, flown back to the United States. But the airport got socked in with fog. And in a very brief time, he had to put his trust and confidence in a surgeon from another country. And he said the surgeon, came very close to him, held his hand, and within minutes he put his trust based on the way that physician, the bedside manner of that physician, putting his trust in a physician in another country. It was so compelling. So I said, we have to invite him and have him come down and spend the afternoon with us and talk to our faculty, our residents, and our students about this event. So these are some of the things that we're doing. We also have an honor society here that's Gold Humanism, founded by the Gold Foundation. And each year the students elect their classmates to this honor society who best exemplify those qualities of compassion, humanism, altruism.
That's awesome. It's giving them a little bit of recognition for that.
Yes, giving them recognition, something to aspire to. Yeah. But we want all of our students to aspire to, being compassionate, caring physicians. That's one of the core values of medicine. It's very important. Medicine does a lot of self-regulation. So I think it's up to us as educators to imbue these values, search for students who first of all have this within themselves, and then best nurture it and develop it for the benefit of our patients.
Now, can you see that by just having a one-on-one conversation with them if they are really cut out for the giving a good patient-doctor relationship, like being compassionate? Like, is that something that you can see?
So this is also a journey, and we look at the student in all respects. So some of that comes out in their letters of reference, their activities that they've been involved in. But yes, a lot does come out during the interview process, questions that are asked of them specifically with regard to, and this simulated patient experience too during the interview process.
Yeah. So finally, what are some of the things that you see changing in medical education over the next 5 years or so as a new generation of doctors are now entering the medical profession?
So some of the things that I see an emphasis on interprofessional care of patients. That I'm convinced is the wave of the future. I'm also seeing more of an emphasis on developing the professionalism and habits of our students, more work in simulation, for example, with scenarios, more of the recognition, too, of medicine as a continuum. Your education and your professional responsibilities don't end when you get the MD degree.
Yeah.
It's a process, a lifelong process. So going from undergraduate medical education to graduate medical education and then into the practice of medicine is very much a continuum, and more of our recognition of that continuum. I think we're also going to see more students going at sort of an asynchronous pace, where maybe you could finish an aspect in 2 years. It might take me 3 years to do this. So we'll see more of that. And then if they could do the first phase of their education in a quicker manner, more of an emphasis on the second phase, which is the clinical care of patients and learning more about health systems. So 3 pieces, not only basic science and clinical science, but introducing that third piece, the healthcare science, which is the quality, the patient safety, patient-centeredness, a lot of the things that hospitals are working on now in hospital systems as well.
Yeah.
We have an experience within our curriculum for a relatively small, it's a pilot project for a small cohort of our students. I want to go large with it eventually. And it's a patient-centered medical home. So in that venue, we have our students working with nurse practitioner students and PA students. And it's a special experience for them. And we've specifically developed the faculty who are working with them to best foster that type of setting.
Yeah, I hope that works out. That's awesome.
Yeah.
So thank you so much for your time.
My pleasure.
We really appreciate it.
My pleasure.
For the Power of the Patient Project, Dr. Reboli and myself, thank you.
Thank you.